My name is Polina Gosensky, PGY2 at Florida Atlantic University Internal Medicine Residency Program, and I'll be presenting spontaneous Streptococcus parasanguinis peripancreatic abscess in the absence of insult. Pancreatic abscesses are typically associated with acute necrotizing pancreatitis, recent instrumentation, or less commonly from malignancy. Streptococcus parasanguinis, or S. parasanguinis, is an oral microbiome. It can also be found in the small intestine, and most of these infections that come from S. parasanguinis result in bacteremia and endocarditis. We present a gentleman who developed a pancreatic abscess without previous episodes of pancreatitis or underlying malignancy with this uncommon bacteria. A 56-year-old male without any known past medical history, who was a current smoker, presented to our emergency department because he was unable to tolerate any food for several days. He had sharp periumbilical abdominal pain. It started as a diffuse ache for the previous 2 weeks. It progressed, and he's never had anything similar to this in the past. He also had an episode of bilious emesis and night sweats. The patient had an unintentional weight loss as well, 15 pounds over the previous 5 months. He smoked a pack of cigarettes a week and didn't drink any alcohol. On presentation, he was hemodynamically stable. His lab did not have any abnormalities, including tumor markers. Imaging revealed what is shown in figure 1 here, A and B. A is the CT scan, which had a dilated proximal pancreatic duct, about 2.8 millimeters, and a mass that was 3.2 by 3.3 by 3.7, and it was encapsulating the superior mesenteric artery. The MRI in panel B shows similar finding, and the patient then had undergone an endoscopic ultrasound with fine needle aspiration biopsy by GI. The cultures from those lesions revealed S. parasanguinis. The biopsy revealed inflammation without any malignant cells. A week after antibiotic therapy, he underwent the same procedure, and it revealed the same microbiologic and pathologic findings. He then had repeat imaging a month after that, which revealed no lesions, a normal pancreas without any masses or collections. Pancreatic abscesses are commonly associated with acute necrotizing pancreatitis episodes, which result in pseudocyst formation. These patients are typically critically ill, they have a prolonged course of recovery, and there's high morbidity and mortality with these types of patients. Uncommonly, the patients develop such complications from a silent episode of pancreatitis without the presence of a pseudocyst, unless the patient may have like an old cold or undiagnosed malignancy. S. parasanguinis, it's an oral microbiome, which at times could be found in the small intestines. Translocation of the bacteria to the pancreas is possible if there's inflammation or injury to the area, but otherwise it's very unlikely in the absence of such. Some studies have found these infections with underlying pancreatic malignancies, which cause inflammation, thus translocation. But in the absence of recent pancreatitis events, awareness must be high in these patients when they present with culture-positive S. parasanguinis with intra-abdominal infections in order to catch malignancy. Spontaneous formation of these abscesses has yet to be reported, as was in our case.